righty, it is 1:45 Eastern Time, and I think everybody is back. So why don't we get started with our panel on social and political determinants of health. As I mentioned, I'm Ruqaiijah Yearby, a professor of law at St. Louis University, and I will be moderating this panel with Dawn Hunter, who is Deputy Director at the Network for Public Health Law. We have Dean and Dr. Dana Bowen Matthew here, who is the Dean of the George Washington Law School. We have Jay Nadine Garcia, who is Executive Vice President and Chief Operating Officer at the Trust for America's Health. We have Samantha Bent Weber, who is a program analyst with the Centers for Disease Control and Prevention's Public Health Law Program. We have Professor Scott Burris, who is Professor of Law and Director of the Center for Public Health Law Research at Temple University Beasley School of Law. We have Edward Ellinger, who is acting chair at HHS's Secretary's Advisory Committee on Infant Mortality, and Sarah DeGaia, who is Chief Executive Officer at Change Lab. And again, I apologize if I mispronounced anyone's name, please correct me. And with that, I'm going to turn it over to Dawn Hunter.
Hi, everyone, and thanks so far for a great discussion. And I think you'll find that we're about to enter a panel that will combine some of the elements of each of the previous panels. We have a really nice transition from this last panel in particular, where we heard about some of the barriers to vaccine equity that are also more broadly barriers to health equity. And as we developed the vision for this panel, we had a lot of ideas, but they generally centered on the role of law and policy in shaping the social and political determinants of health via three kind of key areas: institutional practices, training and workforce, investments and spending to improve health equity, and data collection, policies and practices. So these are the ideas that we had, but we want to start out by asking you, from your perspective, what even are the social and political determinants of health? And what is the most important issue in this topic area that the audience should know about? And who wants to kick us off? I know Dean Matthew was really touching on this at the end of the last panel, and it might be nice to lead off there.
Okay, I'm happy to start off also because I'm going to duck out of this panel a little bit earlier, but I'm looking around the room and I know a lot of people on this panel have a lot better handle on this than I do. So I'm going to take the 35,000 foot level and continue my role as provocateur. One of the things that I know that Scott and Nadine and others are going to drill down on is the empirical connection between law and health outcomes. I want to talk a little bit more theoretically about a miss that we have not paid a lot of attention to. And I hope Sarah DeGaia will back me up on this because I know that the Change Lab Solutions has been very active on this. And that is the use of civil rights law to address health disparities in every single one of the social determinants of health, right? So anybody who's very serious about health disparities should also be very serious about voter suppression right now. So if we are seriously interested in changing the fact that communities of color live in more polluted places, so they breathe dirtier air and drink dirtier water. If we are seriously concerned about the income gap that not only is the result of residential segregation, but is also the result of educational segregation that persists throughout the United States, thereby underpreparing people to compete in the labor market. And we do see the connection between those civil rights disparities and the very plain disparities in morbidity and mortality that we are seeing, not only in the outcomes with respect to COVID-19, but in the solutions with respect to COVID-19. Right? As I said on the earlier panel, and I just have to say it again in case there's a different audience here, white people are the only people who have more vaccine prevalence than they have death, disease, and cases. African Americans die more, get hospitalized more, get diagnosed more with COVID-19 than they get vaccine. Same with indigenous populations. Same with Asian populations, same with Latino populations. The only people who are getting more vaccine than they're dying are white people. That is white supremacy. And it is no surprise to those of us that have been doing disparity work for 10, 15, 20 years. So although it is true the COVID-19 pandemic blows all other use cases out of the water, this is unusual, extraordinary, exceptional. There is nothing new under the sun here. And unless we get serious about racial discrimination in each of the social determinants of health, we are not serious about health disparities.
Well, thank you for queuing us up on voter suppression in particular. We're going to talk a little bit about civic engagement in the next panel. But maybe I can ask Sarah to comment on the piece that you comment on what we're missing, which is the use of civil rights law to fight discrimination in all of these areas that you've been mentioning. Sarah, do you want to chime in here?
Sure, and thank you, Dean Matthew, for queuing me up here. And a lot of the comments that you said earlier, I think, are just absolutely right on. So I just want to underscore what you've been saying, and also allude to something that Francis mentioned earlier around critical race theory. I think that, you know, as lawyers, as health, working in the healthcare field, as advocates, we tend to kind of think within our own silos. And I think what COVID has really lifted up is that we can no longer think in these silos. We really need to take that extra step in terms of working together and really understanding and leveraging each other's strengths. So we did publish a paper that just came out in UCLA Law Review this past year, where we look at the things that we can learn, the strengths that we can learn from the social movements that are happening, Black Lives Matter, the Me Too movement, really understanding that place of power and the role that community needs to play within helping us understand decision-making and actually helping to participate in decision-making, helping to lead decision-making. And then in the public health perspective, using that data. The data is not the ends, right? We don't just stop with the data. We need to actually utilize the data to help drive where do we identify where the resources and the investments need to go. So the answer is not in the data. The data is a tool in order for us to understand what needs to change. But I think we get so caught up in like, we got to have more data. No, it doesn't end there. But we need to really embrace and understand what public health has been doing for a long time, which is looking at that population data and really understanding it, but going deeper and looking at it from disaggregating that data and really understanding the depths and the breadth within that information. And then the last piece is, this is where the lawyers, I think, really come into play, and where we do bring a strength into this conversation, which is the important role that laws and policies play in either reinforcing systemic racism or as a means to address systemic racism. So the legacies of segregation have not been erased and have not actually been addressed, because all we do is continue to look forward. But as we mentioned earlier, we need to actually look backwards. We need to understand the impacts that segregation, that racism has played, that exclusion, that slavery has played within our society, to then be able to understand how do we redress and how do we move forward. So Ruqaiijah, Professor Yearby, you mentioned truth and reconciliation. We need to have those discussions. We need to make space for that. And I do think that cities and counties declaring racism as a public health crisis actually opens the door for us to have those conversations. But again, that's the first step in order to then identify what do we need to do next. So really understanding the role that civil rights can play. What are the tools? And also recognizing that a lot of those tools have been blunted over the years. Dean Matthew, I know your book, for example, really lays out a really nice framework for understanding how do we actually strengthen those civil rights tools over time. So I think we are on the precipice. We have a lot of leaders who are acknowledging race, who are acknowledging disparities and inequities in our society. And I do really think that this is the moment to take what tools we have and to really move the conversation forward.
Sarah, all excellent points. I'm going to pull out one thing that you said in particular, which is using data to drive resources and investments. And I'm going to ask Scott to join us in on this part of the discussion right here.
Well, thanks. Although I think you guys have inspired me. Let's put it that way. So many comments and so many brilliant points throughout this evening that I've been listening to, and it's sort of driven me away from my usual point, which is we need to study the effects of laws on health. We need to, if we had been properly studying the effects of laws on health, it wouldn't have taken 50 years to find out that the Fair Housing Act didn't put much of a dent in segregation. We would stop looking to fake solutions and depending on them for so long. We might have realized earlier the depredations of the war on drugs. Controlled Substances Act was passed in 1973. And it's 30 years before we get the new Jim Crow. But I can't resist taking a bigger answer to this whole set of questions that you posed, because I too am a big fan of Kamara Jones and was reflecting on her allegory of the garden. The idea that she had these 2 garden plots, one that she nurtured with new soil and fertilizer and watered carefully, got these beautiful flowers, and another which just had old soil, never been cared for, actually probably been the dumping ground for junk and chemicals, and it barely supported any healthy growth. And her point was, you can't, flowers grow in the soil. If you want healthy flowering, you got to have healthy soil. And until we really look at that soil, the underlying social conditions, we're not going to have healthy growth that's equitable across all parts of our population. So for me, the fundamental imperative that is actually sort of happening now a little bit, and which we cannot lose, is to make long-term substantial changes to the policies that drive inequities, and that could, if they were reformed, maybe turn around some of the inequities and disparities. We are in a society now that has, for the last 40 years, done everything possible to make rich people richer, and has successfully created the greatest inequality and the lowest social mobility in our country in a century. And in keeping with the old physical law that high water is always worse for those on the lowest ground, this general inequality has been disparately hard on people of color, and particularly people whose family trees in America are rooted in enslavement and generations of consistently hostile de jure racism. And I think this is an important point. I think critical legal studies in law school is a great topic. We all ought to have it. We don't all have it. But even more than that, we need legal history. My students come to law school with this kind of vague notion that Lincoln and the Civil War freed the slaves, and there were a couple of bad moments in there, Plessy v. Ferguson and all, but then Thurgood Marshall came along, the Supreme Court, got rid of segregation and racism, and everything's been great since then, mostly. They have no idea. They have never been taught about the consistent and unrelenting use of law to subordinate Black people in America. That has gone on without cease to this day from the Civil War. Obviously one of the first things we have to do is just stop doing racist things to Black people through the law across the board, as many commentators have already spoken about. But I think every policy reform discussion that we have also has to lead us back to 3 deeper questions that we need to ask about every policy. Are social resources being devoted to investments that create and security and opportunity for most people in this country, not the 1%, not the top 10 or 20%, but the vast majority of people who are, not doing so well in this country of all races. And then secondly, doing that, taking up Dean Matthews' point, are we ensuring that racial disparities are being redressed and not perpetuated in these reforms? Because we could easily fix a lot of things for some people and make things worse for other people, as Dean Matthews said. And finally, are enough resources being collected to make the necessary changes? We are talking about serious redistribution of wealth in this country. So if we are not talking about major tax reform, both in individual and corporate tax, and inheritance taxes and so on, if we're not talking about huge investments in housing and education, to get rid of homelessness, to get rid of substandard housing, to get rid of poor education. If we are not talking about taking this germ of a guaranteed basic income that we saw in COVID and making that a basic entitlement for all Americans, then I don't think we're serious. I don't think we're going to succeed, because we cannot bring social justice for anybody, as is said, without substantial economic justice for everybody.
Scott, that's difficult to follow. Great, your points are great there. And I want to ask Ed or Nadine if you want to jump in here and talk about, what this looks like on the ground and in terms of targeting resources to impact population health.
Yeah, Don, let me jump in. It's nice to be on this panel of great legal minds, and I don't have a great legal mind. I'm a physician who's been in practice and working in public health field. But Don, I want to get back to your original question to this group: is what are the social determinants of health? And I also want to. I'm glad I'm following up Dean Matthew, because I want to highlight the fact that she said so eloquently that if we're not focusing on equity and particularly structural racism, it's public health malpractice. I mean, it is central to what we're doing. It's public health malpractice if we don't focus on that. And what I really like about the whole issue of social determinants of health is that most people in the general community think that if you just made good personal choices about diet and physical activity and exercise and had good medical care, you'd be healthy. That's the common mantra. That's the worldview. And we know increasingly that it's really where the conditions where you live and work and go to school and worship that really impacts your health. And those are the things in those communities that impact your health are beyond your individual control. They are social control. That's where it gets away from this whole idea of the individual being responsible. And, I certainly think individuals need to take some responsibility, but the big issues are really social. And so social determinants of health are the things that impact your health that are beyond your individual control. And those things are really structured based on policies and systems and environments that have been put together over the years that have been based on a structurally biased, racist perspective. And for us, and I always argue, I'm always asked, why is an old white guy talking about equity? Because we're all in this together. And I think those of us, and it really struck me when I was a state commissioner of health back in 2014, as a privileged heterosexual male physician, white physician, to say that structural racism was the centerpiece of the problems that we're having in Minnesota related to disparities made a big difference. It opened up the conversation for folks, and the communities of color said, thank you for identifying what we've known all along. And now we're going to hold you accountable for making some differences. And this is where, we need to get communities engaged, and we need to have the communities hold public officials accountable. And then this gets at the voting things, which we're going to talk about on the next session.
Well, thanks, Don, for opening us up, and just to build on what everyone has shared. It's really been great to listen to all of these panels today. Where Ed just left off with regards to talking about the social determinants of health, and I come at it as well from a public health and health equity lens and perspective, is understanding too and not conflating the issue of social determinants and equity, because all of us, right, experience the social determinants of health with regards to the conditions in which we're born and live and worship, et cetera. But that there are those wider set of forces that actually shape those conditions. And that was something that others have mentioned with regards to issues like who holds power in communities to be able to make those decisions. And that then brings us to, Dawn, what you earlier asked about the political determinants of health. And I'm sure many of you, if you have not have read Daniel Dawes's book on the political determinants of health, and where he structures and talks about the elements of voting, of government, and policy as being those three key elements within the political determinants of health. And so it ties to those social determinants of health, because we all experience them, but what we're seeing, and certainly the COVID-19 pandemic has shined a bright light. We in the health equity movement knew that these inequities existed, but shine a bright light and have also exacerbated those inequities. And we see them not only in health outcomes, but certainly in the social and economic conditions. And we then consider, how did those conditions come to being? And you think about then really those levers and those dimensions of voting, of government, and thinking about government structure, policies that have been perpetuated over generations, not only at the federal level, but also at the state and local level. And then consider as well the policies themselves, and looking at how you examine, so an entity like government that can examine, should a policy actually be dismantled because it is having inequitable outcomes on populations? Should there be a new policy that is created? Or should policies be continued? And so I think there is this intersection between the two. And I appreciated the point, the National Academies of of Science, Engineering, and Medicine had a report in 2017 that affirmed that point. We hear this often when we're speaking to policymakers or others about this. It's individual choice, or it's randomly occurring, and understanding that these health inequities and these health injustices that we're seeing, they're not the result of individual choice and a random occurrence, that these are generations of inequitable structures and systems and policies and norms that have been accepted that are perpetuating these inequities and are now having a collective impact that are certainly disproportionately impacting communities of color.
So to follow on that, I want to go back to actually ask Melanie, because you were talking a little bit about this from an institutional perspective, to build on what we were just hearing Nadine say about what it looks like to then address the social determinants of health in the institutional setting that you're in.
Sure. So I am a public health professional first, but now I'm a lawyer and I'm practicing in a pharmaceutical biotech company who has publicly made, their commitment to addressing disparities in care and racial inequity in healthcare. And I think one of the ways in which we have made our commitment firm is acknowledging that the social determinants of healthcare they do impact, people of color. And one area in particular we focus a lot on is childhood trauma. And we have committed over $20 million just in the last year to efforts to really address the impact of childhood trauma on children of color, in particular, who are disproportionately impacted by trauma, and how that has an impact on their overall health outcomes. And so I think taking steps like that is an important first step in addressing, the health equity or health inequities in our community. And I guess more broadly, I think, as we're talking about the role of academics, the role of government agencies, something that Dean Matthews said that I really appreciate is that this, the way that we're tackling these issues really is a multidisciplinary approach and does really require the input and effort of various entities, including the pharmaceutical and biotech and medical device communities. I think they're often kind of looked to sometimes as a source of some of these areas or some of these issues. But I think that there is a role that attorneys like myself have too, in holding our leadership accountable to putting their money where their mouth is, to putting their money where their commitments are. And so the ways in which they've supported something like childhood trauma, or the ways in which we leverage our PACs to support laws that might have a disproportionate impact on communities of color, and really leveraging my seat at the table to speak up and talk about the impact of you supporting certain tax incentives that might benefit you as a company, but are going to have a significant, serious impact on the health and well-being of our Black communities. And so there's lots of ways in which I think we can leverage our voices as lawyers too, sitting at the table, not just through laws, but also speaking up to our leadership about the impact of things that they're supporting and its adverse impact on our communities.
Well, I'm going to ask Sam to jump in here and share your perspective too. How are we leveraging our voices to address some of these social conditions, and what does that mean, social conditions versus social determinants in a healthcare setting and in a public health setting?
Thank you very much for allowing me to participate on the panel. It's been a really robust and enriching conversation over the last many hours, and I've really enjoyed it. I just want to go back. I'm sorry, Dawn, I may not totally answer your question.
Totally fine.
But I want to go back to this idea of defining the determinants of health. And, one of the things I've been thinking about a lot is, do we need that language? Do we need the language around social and political determinants of health? Whose imagination does that capture? Does that really help ordinary people who are not in public health practice, people who are not lawyers, to sort of fully grasp the idea that social conditions, where you live, the experience you have, the access to tools and resources of power, does that get you better health? Does that language sort of help people to sort of internalize the idea and then think about how they can help to move the needle around social conditions and improve health? It's something that I grapple with a lot, because I think, to your point about sort of moving the needle on this issue, part of the story here that I think is one that people within health and public health practice need to engage with, but also lawyers who have a tremendous number of tools in our toolkit around engagement with people, is that, we have to figure out the communication story, right? Like, how do you tell the story about the ways that laws have harmed people in a way that's accessible? You know, to Scott's point about sort of what law students don't know when they come into law school. That's a problem that exists across all disciplines, across the entire population, right? We just don't have an historical sense, but we also don't have a sense of what it means when people talk about inequities or inequality or poor conditions and populations that get disproportionately harmed. We don't really know how to trace, right? Federal laws, local laws, state laws, we haven't figured out how to sort of trace the way that the legal infrastructure has directly and acutely impacted people's conditions and lives, like the decisions they make, the resources they have, the places they go, their sense of their opportunities. And to me, that is a big part of the story of capture, of like moving the needle on structural racism and moving the needle on the discourse around determinants of health and advancing health equity. So I started by saying, do we really need to talk about determinants of health? But one thing I want to say is, the point that I think we need to figure out a way to be able to articulate for people, all people, including people within the legal discipline itself, is that law is a concrete determinant of health, right? Lots of us talk about this, who work in the public health law space talk about this. Sarah and Scott have written about this a lot. But in terms of like articulating it among the broader public, among people within public health and outside of public health practice, that law determines health and law drives health, right? I think we've got to we have to look inward, is what I'm saying. We have to look inward and think about ways that we can interrogate the way that we think about and do public health law practice, but more broadly, the way that we think about and do legal practice, right? Like how does public health thinking also inform the way that we practice as lawyers and think about the law and interpret the law and help policymakers and communities think about and engage with the law. And I think, it's such a sort of 35,000 foot point I'm making, but it's actually really practical and concrete in so many ways, particularly because everyone here is engaging with students, engaging with the public, engaging with policymakers, engaging with people in private industry. And, I think that is a conversation, an ongoing and robust conversation that we need to have and continue to have every day, all the time, about how we talk about this stuff and how we begin to articulate change making, right? How we trace the nexus between law and health, and then what we do with that, right? So I'm going to stop there.
Sam, you're speaking my language here. Everything that you're saying, just is really spot on. I was thinking, actually, one of the things I wanted to pose to the panel is really, how do we talk about social determinants of health when we know that's a term that is a huge turnoff for some policymakers and some, right? How do we talk about the impact of laws, all the evidence that exists about the positive impacts of Medicaid expansion, and we still have states that are holding out and states that are trying to overturn ballot initiatives, right? The impact of minimum wage increases on people of color. Despite the evidence of the success of all these laws, we still have people saying, yeah, I don't really think that's a thing. So, I want to pose that to other panelists. How do you suggest, what are your suggestions for how we talk about this and how we approach this with people who maybe are just not quite there, but could get there?
Dawn, that's been one of the blessings, the side blessings of the COVID epidemic and the racial violence that has spun off of here in my hometown, the murder of George Floyd. All of a sudden, people are recognizing that there is a large population in our society that is not is not part of the conversation, and that it's the economic policies, the social policies, the educational policies, the legal framework, who's at the legislature. It's all coming together, and it's really tangible because they're feeling it in their community. They're feeling it by how safe it is walking down the street. They're feeling it by who's dying in their neighborhood. So this is the opportunity that we have to then craft our stories around the crisis that's going on right now about racial violence, or still disobedience and racial injustice protests, and COVID. This is an opportunity. So that's where we're trying to bring the stories around those two episodes.
I really think it's as basic as it's about power. It's about power and opportunity. And I think there's a notion that laws and policies really can help to either emphasize who has the power or who doesn't have power and opportunity. And I think if we're talking about how do we talk to community, it really is about how do we make sure that people feel that they have their own power, that they have a sense of agency, that they can actually participate in the process. And part of that to me is about sort of demystifying what the law and policy practices are, but it's also about making sure that government is accountable and that they do have policies and that they have an engagement practice that is actually really welcoming, and that where people feel like they can meaningfully participate in making those decisions that are going to have an ultimate effect on themselves. And I think right now we do need to do the analysis and understanding, and there is a way to do that. There are practical ways of understanding and analyzing laws and policies to understand who will benefit from these laws and policies and who will not benefit. And those are things that we need to make sure that cities and counties and state and the federal government have as they are bringing down the big dollars, right, from building up local infrastructure, or as they're thinking about rolling out racial equity initiatives. And then also really thinking about the role of preemption, for example, and taking away that power or authority that locals may have versus states and federal governments. And the last point I wanted to make was just in terms of really having, I think it's important for our government levels to understand that they work best when they are in coordination with each other. And when they are not in coordination with each other, then that's when who is most affected is going to be community members. Government is their role is to protect people's rights. There is no other entity who is going to protect our rights other than government. And so we need to have them understand that role and that responsibility. And we need them to be at the table and really and having much better coordination and communication so that then community does feel empowered and is a part of that process.
I would also throw in time and a little bit of self-care or patience with ourselves on the communications issue. I mean, you know, it's easy to feel like you're not getting the message across whatever language you use because change seems so slow and painful compared to the need for change and for the possibilities of change. We have to keep in mind that the people who taught America to believe that who taught a bunch of Americans who loved FDR and were delighted with the New Deal, that the government is the enemy, and that, you know, the best they can do for you is keep its hands off your Medicaid. They spent 30 years and billions of organized dollars telling that story again and again and again. When Barry Goldwater ran for president in 1964 and was trounced by Lyndon Johnson, people thought the idea that, you know, his attack on government was absurd. Nobody was into that. But the people who supported him just kept saying the same thing until Reagan came along, until, you know, you had enough repetition. So, you know, I think I absolutely agree with Sam that we don't need to talk about social determinants most of the time. Oftentimes, you know, we just have to talk about the terrible things that are happening, because that really gets people know that, and they feel bad about that, and they want change. If you know, we have systems of policing that involve finding people into poverty, finding people into jail, burdening people with, you know, crushing court debt. We can talk about that on that level as such. It's just cruel to take people who have $1,000 in their whole life and charge them $1,200 for a traffic ticket. But I also think that we have to have a positive, inspiring vision. That's how systems change. Systems ultimately change with the big picture. And we have the best picture there is. There is nothing better than an equitable society where everybody is respected, where everybody has an equal opportunity and has a chance and can make a good life. And there are lots of people who don't feel we have that now. And we have the opportunity to offer that in contrast to people who think we should have a winner-take-all society where, a few people win and the rest of us, well, we're losers. We should be able to sell that.
And I think there are elements, excuse me, Scott, I think there are elements too of really knowing and understanding the audience to whom you are speaking, and what might drive change. And I agree with the point that some things are going to be able to move more quickly than others, or some points are going to be able to move more quickly than others, but knowing what drives change and knowing how we communicate that, whether that's through stories and narratives, whether that's through data, and how we present data also with a framework that actually promotes racial equity and doesn't stigmatize communities, as well as looking at, in many cases, making that economic and business case, especially in the case for policymakers, where sometimes that feels like it's the antithesis of what we would want to do because we're trying to come at this from a humanistic perspective, but understanding that there are going to be these different ways in which we can explain these issues, and understanding and tailoring to the audience, and then taking an opportunity where there is some type of a social movement or something that may be expected or unexpected. We can talk about the racial violence that we have seen and what the nation is currently experiencing, but racial violence certainly has existed for generations. But when we see this type of a movement now, how can we actually use this to lead to transformative change? And I think that, and to do so, I really appreciate it as well in a way that's interdisciplinary, because this is not something that public health can do alone or healthcare can do alone, or in the legal profession. We have to come together across these various sectors, public and private, as well as other sectors such as education and criminal justice, to see this as a holistic approach to really transforming and creating healthier and resilient communities.
This is a dynamic discussion. I just want to point out really quickly, we're going to have Heather and then we're going to have Sam, and then I'm going to turn it over to Ruqaiijah for any closing kind of comment or question. All right, Heather, take it away.
Thank you. And I'm going to try to not repeat the ideas that I think that I've heard from lots of my colleagues. And I'm going to go back to kind of something I said earlier about the role of other disciplines. And I think Professor Garcia, you may have just mentioned this as well, or Dr. Garcia, I apologize, not knowing which. But I think the idea that we really need to, particularly as lawyers, we often are asked to come in as the experts or the one to explain everything to other people. And I think it's really important for us to be, and this goes to what someone put up about the role of grace, daring to fail. I really think we need to be willing to listen to both people who are going to ultimately be the most impacted by some of the policies, and not simply later, but having people at the table. Again, I'm gonna be a broken record, driving and helping to lead the conversation or leading the conversation. And I think Sam made a good point earlier about whether or not we really know what we mean when we say community. How do we define that? And I think that's the conversation that Sam Weber brought up that really needs to be had as well. But also other professionals. We're talking about messaging. Are we engaging with communication specialists or people who do political messaging? And maybe we are, but where we aren't, should we be? I said at the beginning, I do social work. Social workers often are working directly in communities, and if asked, could tell you who they see as leading voices, and then going to the community and asking them if they see the same thing is important as well. And acknowledging social work sometimes can function as an arm of the state as well in a negative way. So really considering all of those things, but thinking about those professions that are already doing some of the work that we as lawyers who are trying to craft policy could have taken off our plates as we do our work. And I think, Scott Burris, I mentioned this earlier, but that transdisciplinary public health law really, I think, does a nice job of touching on each of those issues that we all could from our own perspective take and think about what that would look like. So I know we're short on time, but I just really wanted to make sure that again, the community piece and Sam's wise admonition to think about what we mean when we say that, and the transdisciplinary component, I think could really enhance what we're already working towards in public health law and policy.
Just to sort of perhaps repeat myself, but also to piggyback on some of the other comments, I do agree with what others have said about this being a rich opportunity for us to not only think about how we can make change and move forward, but also step back, right, and remember what we're doing, right, and why, where health fits in the larger story about how our society is structured and operates and functions. How do we centralize health in the larger story about who we want to be as Americans, what it means to live in the society and to engage with the society and the government and the system and structure we have. And I think we're in a difficult, complicated, contestable, but also rich time of potential and opportunity. And so I'm trying to focus on being optimistic around that too. And I hope that we can center the sense of possibility as we think about how we look at our disciplines, right, within the context of health and public health, but also other disciplines. My sister's a transit planner, and we talk constantly about transportation, you know, and how there's this tremendous overlap in the way that in some of the challenges we see in our respective disciplines and how we can do more to advance equity. So I'll stop there.
All right, so I want to thank everybody for this conversation. One of the things I want to add in the closing, which hopefully you will get to as we talk about civic engagement, is that when we think about the structural, social, and political determinants of health, that when we talk about race, that we also have to connect people's other identities, which at this time are also coming to play, particularly in states deciding to pass laws to prevent access to care for LGBTQ and trans individuals. That when we think about racism, right, it is not just one individual, it is a part of individuals' identities, including their sexual orientation, their gender identity, age, disability status. So as we think about these issues and laws and how they have played out, we have to think about how it's impacted all of these marginalized groups, particularly at the intersection. So with that, I want to turn it over to Dawn. I know you're going to start us on our next panel, and I want to thank all of the panelists who participated in that panel. Thanks.